We spoke with President Biden's top medical advisor, Dr. Anthony Fauci, for a wide-ranging conversation before the new variant, Omicron, was detected, and as the deadly Delta variant continues to spread. Are we in a fifth wave?
Well, we certainly have the potential to go into a fifth wave. And a fifth wave, or the magnitude of any increase, if you want to call it that, it'll turn into a wave, will really be dependent upon what we do in the next few weeks to a couple of months. For example, we have now about 62 million people in the country who are eligible to be vaccinated who have not yet gotten vaccinated. Superimpose upon that the fact that unquestionably the people who got vaccinated 6, 7, 8, 9, 10 months ago, we're starting to see an understandable diminution in the level of immunity. It's called waning immunity. And it was seen more emphatically in other countries before we saw it here. For example, Israel, which is usually about a month or a month and a half ahead of us temporally with regard to the dynamics of the outbreak, the administration of vaccines, and most recently, boosters. So now we know that although the vaccines are very effective, and the data that you look at are incontrovertible, that if you compare unvaccinated with vaccinated, infections, hospitalizations, deaths, dramatically multifold more in those who are unvaccinated. However, given the waning of immunity, right now boosters are going to be very important.
You said in the past that you would like to get under 10,000 infections a day in order to sort of live with COVID.
Right. We've heard people say, understandably, they're trying to look for a metric to give to the public, that we're going to have to start living with COVID. I believe that's the case because I don't think we're going to eradicate it. The best way you can get to where you want to go is to just say, we're going to vaccinate as many people as we can, we're going to get as many people boosted as we can, and we're going to get that level down. And I think that's going to have to be as low as less than 10,000.
Is it really realistic that we have to get to 85% of the population, which is what you've said in the past, in order to sort of have herd immunity? I mean, it seems almost impossible to get there.
Let me get to that number, Margaret, because it really is important. We have to be very humble about it. We don't know what that number is. And the reason is the number is a moving target. Because if you get someone who's vaccinated and he wanes down and gets below a certain level, I don't know whether you can count that as a full protected person, which is the reason why it's a combination not only of getting the total population vaccinated as a primary, but also getting people boosted. And that's what I mean by a moving target.
So what you're describing is never really having control necessarily of COVID, but learning to, get boosted every 6 to 8 months?
Great question. And that's what we don't know. The important part when you're dealing with a unique, never before experienced outbreak of a new virus, that sometimes you can extrapolate what you know about other viruses because there's some commonalities, but sometimes you have to realize that this may be very unique. Right now, we do not know definitively what that course is going to be, whether it's going to be a 3-shot and you're done, or 3 shots and then every once in a while you have to reboost. We'll have to see how things roll out.
Why isn't the CDC tracking breakthrough infections? Wouldn't you be able to better answer that question if you knew?
Yeah, I mean, yes, in many respects they are. One of the things that we
among healthcare workers.
We need to do a lot of things. We really need to find out when you do boost an individual, how long does that immunity last, both from a laboratory standpoint and from a protection standpoint.
Why did the United States decide not to track those
Well, it's a very
infections?
complicated situation, and often the public doesn't hear yet in time things that are being collected. So there's a lot of data, clearly a lot of data that's being collected by the CDC that people don't know about yet. So we need to make sure in real time we get that data out. Historically, when you're not in a pandemic, you can collect data, you can analyze it, you could talk about it, and then you could look back and say, this is what we've done. But when you're dealing with a pandemic, you've got to get that out in real time so your policies can be dictated by data that occurred relatively recently, not data that occurred 4 or 5 months ago.
That's the criticism, that they're too academic.
Right. Yes.
But is there data being collected now in the United States about breakthrough infections
Yes.
that the public doesn't know about?
Yes, yes, yes. The CDC is collecting data.
Beyond
Yes.
just healthcare workers, everyday people, you have an idea of what's happening with breakthrough infections?
I don't have the data for you right now. That's obvious. We'll have to get the CDC to get us that.
Each school seems to be handling this differently in terms of masking and not masking, or when they alert parents and the like. What's the most responsible thing for parents to do if they know they're sending their child into a classroom and someone in that room tests positive?
There are a lot of options about that. There's the test to stay. In other words, if you test and you're negative, you don't have to go out and get quarantined. The idea about when you get an outbreak in a class or two to then immobilize essentially the class is functionally very, very difficult to get a good academic year with some continuity about that. And that's the reason why we need to do several things all at once. One, you want to surround the children with adults who are completely vaccinated. Number two, you want to vaccinate the adolescents that we already have been vaccinated for some time, vaccinate the 5 to 11-year-old. And when there is a case in the school, then you really got to do something about.
Sometimes parents don't even know if there's a case.
I know
in the
that,
school.
and Margaret, it's got to be articulated much more clearly so that people know exactly and there's no ambiguity about that. When you don't know what the situation is and you have community spread around, that's the reason why the CDC still recommends masking for the children in school.
But this is one of those criticisms of how our country responded here, which is just maybe it's by virtue of the federal system, but district by district, state by state, different things. And then they look for you for unified, tell me what to do, just tell me
Yeah.
what to do with my kid.
Yes. I know.
Clarity.
Yeah, I mean, but the clarity when it comes to the situation of the public health, we really need to, and I think they are very likely doing much, much better than what the public thinks they are, is to get the CDC to be very clear, to be very, very sharp about what a recommendation is. When there's no data to make that, to then just give a recommendation based on best judgment, if you want to call it that.
And when you say lack of data, this has been a criticism throughout, that there's just not enough information being collected in this country,
Right.
not enough surveillance being done.
Right, right.
Is that still the case in your
We
view?
we need to do more. No doubt about it. No doubt about it. We need to do more surveillance. We need to do more testing.
So when do we get to pull back the public health restrictions for kids? Is it until the toddlers get vaccinated?
No, I think that you're going to see likely a gradual pulling back. When you have to put the dynamics of the outbreak in a community into the mix of your decision making. If X number of months from now, you have a very high proportion of children vaccinated and you are in an area where the level, what I call the dynamics of infection, is very low, I would be almost certain that you're going to see a significant diminution in the mitigation, such as masks and things like that.
We'll have more of our conversation with Dr. Anthony Fauci in our second half hour. Stay with us. We'll be right back. We return now to our conversation with Dr. Anthony Fauci about mistakes made, lessons learned, and whether we'll ever crack the mysterious case of COVID's origin. I want to tick through some of these to see if you agree with some of the criticisms of the public health response. The U.S. didn't have a national surveillance system. Testing was inadequate, and there was a lack of data.
Right.
You agree with that?
Yes.
It was a deadly mistake by the CDC to try to use the flu as a model, according to Dr. Deborah Birx. It meant doctors were looking for spread in the wrong places and did not recognize the possibility of asymptomatic spread.
The idea about not recognizing that it was spread in a very efficient way in an asymptomatic situation was really a problem, because what it did not allow a testing of the asymptomatic individuals.
And the flu model being used, why was it used?
The CDC would do that, and that's the way they looked at respiratory diseases. And it took a while to figure out that this is really, really different from flu in many respects.
When did you realize that?
Well, Debbie Birx and I realized that right in the middle of 2020. It was very, very clear. If you go back on some of the statements I made at some of those White House press conferences, we need to flood the system with testing, which means not just somebody who shows up with symptoms.
We look back at statements, and in February of 2020, very early on there, you were still saying it's certainly a possibility, but it's extraordinarily unlikely that COVID was spreading in the
Right.
U.S.
And that's because we didn't know it at the time.
Why did you have that blind spot?
Well, it wasn't a blind spot because we didn't know, we weren't testing. That was the point. And influenza-like illnesses are not noticed unless you get an influenza-like symptom. The asymptomatic model, that when you have a disease in which you have 30 to 40% of the people who get infected have no symptoms, then you say transmissibility. That was unprecedented in respiratory illness. So I guess you could say, well, you should have known that. The CDC should have known that. But they couldn't have known it from day one. But it should not have taken so long to figure out that, in fact, we have a substantial amount of transmission that's asymptomatic.
It also brings us to why people should have been wearing masks earlier. They didn't know that they were spreading it.
Exactly. And that's the reason why back in January and February we were saying we're not so sure you really need masks, because we didn't realize at the time that there was being asymptomatic spread. As soon as that became clear, there was no doubt you should be wearing a mask.
I point some of these specific things out because they're not political. These were public health mistakes. That's almost scarier.
Well, I think to defend the CDC, if I could for a moment, is that one can say something is a mistake because you know now data now that you didn't know then.
Why aren't we having a national conversation about what went wrong? I mean, apart from this room right now, why isn't there a 9/11 type commission?
Yeah, I think what's going to happen is that you are going to see that for sure, Margaret. I think the lack of doing that now is because you're focusing on getting this thing under control. I would be astounded if we didn't have a very serious look at what went right, what went wrong.
But you want one.
Oh, I absolutely want one.
You were quoted as saying it was the worst possible decision for the Trump administration to have left things up to the states.
Yeah.
Where do you rank that?
I rank that right there, maybe a little bit below some of the things you're talking about, but way up there. People always ask, if you had the magic wand and did things exactly the way you wanted, what it would be. One of them would be, if ever, there was a situation where you needed a synergistic, uniform, well-thought-out approach, is when you're dealing with a common enemy of a virus that is a global pandemic, the likes of which we haven't seen in 100 years. To be able to say, if I don't really want to do this because I want, my own opinion of what it's going to be with this state versus this state versus this state, to me, that's one of the antitheses of public health. How could you possibly have a situation where one state says, oh, I'm sorry, and you shouldn't be wearing a mask? In fact, you have executive orders saying you shouldn't be wearing a mask. You have another
Florida.
state that does not want to get vaccinated because they think it's a political statement to get vaccinated or not. The divisiveness in this country, to me, is the biggest mistake that supersedes everything that we're talking about. I mean, when we look back historically and look back at this and said, we had this devastating plague out there that were killing hundreds of thousands of Americans, and we're having public health principles being decided on the basis of political ideology.
Public health is often politicized, though. I mean, you know that so well from your experience with AIDS. What was the chief lesson you brought into dealing with COVID from that experience with AIDS?
Never underestimate infectious disease outbreak because it can be insidious, the way AIDS was. You learn also to pay attention to what's going on in the community. And that's the major lesson I learned. You don't do it from above and dictate down.
Was that happening at all in China when this first appeared, going back to the fall of 2019?
It was very tough what was going on in China. It's kind of opaque. Clearly there was infection that was percolating, as early as November, maybe even earlier. You had an infection that emerged almost certainly out of animal reservoir. The more you study bats there, the more you see how close some of the viruses are to SARS-CoV-2. So it was assumed in the beginning, well, this is the coronavirus. Why isn't it just assumed that it's SARS-CoV-1, which means it doesn't transmit very well and it's going to get controlled by public health measures, which is exactly what happened with SARS-CoV-1. Then you find out that even though it's SARS-CoV-2, it is a very, very different virus than SARS-CoV-1 because A, it is transmitted spectacularly efficiently from person to person, and B, most of it is about 40 to 50 to 60% is asymptomatic.
Why is it so efficient?
Well, it evolves in animals, it evolves in humans, and it could just, sometimes viruses jump into humans and they take off and run right away.
But we don't know what went between the bat and the human. There was something in between?
Yeah, it was very likely a host. What the Chinese did, I don't have firsthand knowledge of that, but the people who were reporting it, who investigated, what they did is they cleaned out the markets as soon as it turned out that it was clear that there were clusters coming from the market, which, in typical fashion, I think trying to make sure that things don't get pointed to them, they probably got rid of the animals that were the intermediary hosts there.
Beijing acknowledges now that they don't think it originated in that market.
Well, it may not have originated in the market, but it certainly could have.
Well, there were clusters that may have been picked up and transmitted, as I understand it, through the market, but the place of origin was not within the market itself.
No, I don't think you could say that. I think you could say we don't know how and where it originated.
When was the first time that you heard that there was some strange pneumonia?
I think it was the very last day. It may have been December the 31st or the 30th or 1st of January.
When they informed the World Health Organization.
Yeah, I mean, I got a call from Bob Redfield who said, I just heard from colleagues in China that there's a unusual pneumonia among people there that has been detected. So we just got to stay heads up for that. And then a few days later, I think it was January 9th or 10th, the sequence came out. As soon as I heard there was a new pneumonia, I said, well, a new pneumonia, Wuhan, wet market, almost certainly it's going to be a coronavirus. And that's when I got my team organized immediately and said, as soon as we get that sequence of what it is, let's go after that vaccine. Let's plug it into mRNA. We were already collaborating with Moderna with mRNA, and let's do it. And it was rocket speed. About 5-6 days later, we were starting with the vaccine development with Moderna. 65 days later, we did a phase 1 trial, and multiple months later, we knew we had a safe and effective vaccine.
That's incredible speed that you were already there. But it was despite the lack of information being shared.
All I needed was the sequence. I mean, the public health part was handled by the CDC.
Live virus samples would have made a difference for you.
I didn't need it at all. I just needed the sequence to get a vaccine.
We'll be back in a moment with more from Dr. Fauci. Towards the end of our conversation with Dr. Fauci, we asked him about whether there should be tougher global regulations put in place for labs that deal with highly contagious viruses. He brought up legislation sponsored by Republicans that would limit U.S. government support for gain-of-function research, in which experts modify viruses to better understand them. There has been speculation that a lab accident led to the spread of COVID. Dr. Fauci said there are already strict guardrails in place that the public doesn't fully appreciate. This is a political football right now.
Oh, it is a total political football. Total.
And you take the fire specifically for this.
I do. All the time.
There's a congressional act with your name on it.
Yes.
Literally.
Exactly. And it's just a lot of, well, anyway.
Finish the thought.
No, there's a lot of politicization of that. And I think there's a lot of misinformation, disinformation, and outright lies about that. And that's really unfortunate.
You're angry about it.
It's painful and disturbing to see when you're trying to focus all of your attention on doing what you can do, the way we did to create the vaccines, to develop the drugs, to save millions of lives, and then you have this completely outlandish politicization of it. 2
Washington Post reporters said that back in July of 2020, you had been speaking to your wife about resigning.
I never spoke to my wife ever about resigning. They got that wrong. I never even considered for a moment of resigning.
Why do you feel so strongly about that, about staying on the job when you become, I mean, you were personally, not just rhetorically, threatened? Your security, your safety, your family.
Yeah.
How did you deal with that?
I dealt with it by focusing on what my job is. From the time that I went into medicine to the right now where I am at my age, my job has been totally focused on doing what I can with the talents and the influence I have to make scientific advances to protect the health of the American public. So anybody who spends lies and threatens and all that theater that goes on with some of the investigations and the congressional committees and the Rand Pauls and all that other nonsense, that's noise, Margaret. That's noise. I know what my job is.
Senator Cruz told the Attorney General you should be prosecuted.
Yeah. I have to laugh at that. I should be prosecuted. What happened on January 6th, Senator?
Do you think that this is about making you a scapegoat to deflect
Of course.
from President Trump?
Of course. You have to be asleep not to figure that one out.
Well, there are a lot of Republican senators taking aim at this. I mean,
That's okay. I'm just going to do my job. And I'm going to be saving lives, and they're going to be lying.
it seems another layer of danger to play politics around matters of life and death.
Right, exactly. And to me, that's unbelievably bad, because all I want to do is save people's lives. I mean, anybody who's looking at this carefully realizes that there's a distinct anti-science flavor to this. So if they get up and criticize science, nobody's going to know what they're talking about. But if they get up and really aim their bullets at Tony Fauci, well, people could recognize there's a person there, so it's easy to criticize. But they're really criticizing science, because I represent science. That's dangerous. To me, that's more dangerous than the slings and the arrows that get thrown at me. And if you damage science, you are doing something very detrimental to society long after I leave.
Is there a playbook that you are handing over to the next person right behind you at the NIH when that retirement day does come?
Yeah, the playbook for them is to do what I'm doing now. Focus on what your goal is. And your goal is to end an outbreak by what you have at your disposal. And what we have at our disposal is science. If you get caught up in this nonsense of politicization, you're not going to be able to do your job as well.
In this playbook you're handing off to your future successor, do you say the next pandemic comes at us faster?
You know, I think we likely will, though you can't predict. You know, I've been through multiple emergencies of diseases. Some have been one-off, trivial. But I think the idea of the human-animal interface is something that we've really got to address that. You know, that's the reason why I get back to the fact of these wet markets that bring in animals that are next to bats in caves in wherever, who knows, all in Southeast Asia and China.
You want more regulation of those internationally.
I want that to be regulated. I really do. And we know the Chinese were trying to regulate that, but there were people who were breaking the law, and there is good documentation from people who photographed that animals that were not supposed to be brought in from the wild into the wet markets were there. And I think that's the reason why, when this happened, I don't know, but I think, why the Chinese just completely cleaned it out. I think that is one of the reasons why we're not able to find out what the original source was. I think they've destroyed some of the evidence.
We'll be right back.